Pathology of the mammary glands, mastopathy. Mastalgia is swelling, tension of mammary glands, and also presence of nagging, stabbing, radiating pains in mammary glands. Manifestation of premenstrual syndrome. Manifestation of mastopathy. Mastopathy, mammary dysplasia, a fibrocystic disease, characterized by a wide spectrum of proliferative and regressive changes of the breast tissues, with abnormal ratio of epithelial and connective components. Mastopathy. Diffuse fibrocystic mastopathy, with predominance of the glandular component, with predominance of the fibrous component, with predominance of the cystic component. Mixed form. Nodular fibrocystic mastopathy. Mastopathy. Left figure showing non-proliferative form of fibrocystic disease. Sites of fibrous tissue are combined with cystic cavities. Pathological changes are developed in limits of duct lobular unit. Cysts are lined with atrophic epithelium or epithelium. Subjected to apocrinic metaplasia. Right figure showing proliferative form of fibrocystic disease. Marked out, epithelial, myoepithelial and fibroepithelial variants of proliferation. Middle bottom figure showing lobular hyperplasia. Marked out. Adenosis. Atypical lobular hyperplasia. The risk degree of the breast cancer development is increased at cystic changes, and depends on the degree of expressiveness of ductal and intraductal proliferation, Letugin VP. Risk of malignization at non-proliferative form is 0.86%, at moderate proliferation 2.34%, at sharply expressed proliferation 31.4%, Baileyuk.N. Mastopathy. Mastopathy of one type, non-cystic form. With predominance of glandular component. With predominance of fibrous component. Mastopathy 2 type, cystic form. With predominance of cystic component. Mixed form. Electrical impedance, images at mastopathy. EIM. 41 years. 50 kHz. Well-defined undistorted contour of the mammary gland, absence of the internal structures displacement. Electrical impedance images at mastopathy. Left image EIM. 41 years. 50 kHz. Mastopathy. Right image EIM. 41 years. 50 kHz. Norm. Disturbance of architectonic, of images because of the change of accordance, of mammary gland tissues, and its consequences discrepancy, of the type of the electroimpedance. Image, juvenile, reproductive, premenopausal, postmenopausal, to the age. Electrical impedance images at mastopathy. Left image EIM. 41 years. 50 kHz. Mastopathy. Right image EIM. 41 years. 50 kHz. Norm. Disturbance of architectonic, of images because of the change of accordance, of mammary gland tissues, and its consequences discrepancy, of the type of the electroimpedance. Image, juvenile, reproductive, premenopausal, postmenopausal, to the age. Electrical impedance, images at mastopathy. EIM. 34 years. 50 kHz. Mastopathy. The increase of the hyperimpedance areas, 1, on the images with mastopathy, due to the fibrous changes of adipose tissue, ducts walls and Cooper's ligaments fibrous. Electrical impedance, images at mastopathy. EIM. 22 years. 50 kHz. Mastopathy. Increase of the mean electroconductivity zones, 1, due to hyperplasia, of glandular tissue, at adenesis, indices of mean electroconductivity, of mammary glands in the norm and at mastopathy, of the first and the second types at women, of the different age groups during the first phase, of the menstrual cycle, and during the post-menopause, older than 51. 50 kHz, 10 kHz. The second scanning level. Plus or minus SD. Indices of mean electroconductivity, of mammary glands in the norm, and at mastopathy of the first and the second types at women of the different age groups, during the second phase of the menstrual cycle, and during the post-menopause, older than 51. 50 kHz and 10 kHz. Second scanning level. Plus or minus SD. Electrical impedance, images at mastopathy. Regularities of change of electroconductivity, indices on the different scan levels at the different types of mastopathy, are the same as in the norm. Increasing of electroconductivity, with the age of patients in both phases, of the MC and decreasing of indices, with increasing of the depth of scanning are observed. Changes in the structure of mammary glands, at presence of a pathological process are diffuse and have no influence on the processes of involutive changes. Electroconductivity at both types of mastopathy is statistically, validly less in the corresponding age groups at menstruating women, till 50 years, than in the norm. And at the frequency 50 kHz, and at the frequency 10 kHz in both phases of the MC. Predominance of hyperplastic and fibrous changes in the structure of mammary glands regularly decreases the electroconductivity indices at mastopathy, because connective tissue have enough high impedance characteristics and, accordingly, low electroconductivity. Absence of difference in electroconductivity between the norm and mastopathy at women in the post-menopause confirms the fact that dysplasia is the consequence of dysfunction in the system ovary mammary gland and not the disease itself. Changes of the hormonal status at menstruating women lead to the growth of the cellular component that influences on changes of electroconductivity indices. And there are no oscillations of the hormonal background at the postmenopausal period women, thus there is no response of mammary gland tissues that is manifested by a stability of electroconductivity indices and absence of statistically valid difference from the norm. Mastalgia, manifestation of premenstrual syndrome. The syndrome of premenstrual tension, premenstrual syndrome, represents itself the cyclic change of the mood and physical condition of a woman, coming for 2 to 3 and more days before menstruation. Disturbing usual life or work style, and alternating with the remission period, connected to the coming of menstruation and continuing not less than 7 to 12 days. Frequency in a population varies, from 55 till 40% and it is increases with the age and does not depend on the social, economic, cultural, and ethnic differences. Kulakov V.I., Prilipskaya V.N., Radzinskij V.E. 2007. One of the symptoms of the premenstrual tension syndrome is pain of different degree of expressiveness in mammary glands. Expressed mastalgia decreases work capacity, disturbs the life quality, decreases sexual activity at 48% women, disturbs social adaptation at 12%. And makes worse work and educational conditions at 8% of patients. Some consider mastalgia as the potential risk factor for development of breast cancer. Prilipskaya V.N., Volobweva, Shevtsova OB 2003. For determining of rational patient surveillance of the women with mammary gland diseases, it is necessary to work out reliable early criteria of diagnostics of mastalgia, allowing to differentiate its different origin nature, but unfortunately it is not available to do with modern methods of examination of mammary glands. It is possible to determine an etiology of mastalgia by the method of electrical impedance mammography. Indices of mean electroconductivity of mammary glands in the norm and at mastalgia at women of the different age groups during the first phase of the menstrual cycle and during the post-menopause, older than 50 kHz and 10 kHz. Second scanning level. Plus or minus SD. Indices of mean electroconductivity of mammary glands in the norm and at mastalgia at women of the different age groups during the second phase of the menstrual cycle and during the post-menopause, older than 50 kHz and 10 kHz. Second scanning level. Plus or minus SD. Mastalgia, the symptom of the premenstrual syndrome. Regularities of change in indices of electroconductivity at mastalgia are the same as in the norm, increasing of average electroconductivity of mammary glands on at all scan levels on both frequencies, with the age of patients, and decreasing of electroconductivity in both phases of MC with increasing of the scan depth are observed. It confirms once more that involutive processes in the mammary gland happens independently on presence or absence of pathological changes in the structure of the gland, and correlation of different types of tissues in the different age periods, and on the different scan levels, is one of the factors influencing on the indices of electroconductivity. In distinction from the norm, electroconductivity at the frequency 10 kHz is higher than at the frequency 50 kHz during the first phase of the MC, and it is lower during the second phase of the MC in the corresponding age groups. Mechanism of increasing of electroconductivity. Indices at mastalgia at the electrical current frequency 10 kHz during the first phase of the MC is connected to such thing that absolute or relative increasing of estrogen levels in blood serum causes the retained sodium that leads to accumulation of intercellular liquid and edemas. Besides, retention of liquid in tissues is happened because of hypoprogesteronemia, caused by increased prolactin production, which takes place at the premenstrual syndrome. At the comparison of indices of average electroconductivity at mastalgia between the phases of MC in the corresponding age groups at the frequency 50 kHz, there is no statistically valid difference in the indices of electroconductivity, and at the frequency 10 kHz electroconductivity is statistically validly less during the second phase of MC than during the first phase. That is also the distinctive criterion from norm. Electrical impedance, images at adipose, involution. Electroconductivity at 50 kHz is 0,71 AU, what is over the age norm and is typical for mammary glands electroconductivity, in norm and at pathology, at women of different age groups. 50 kHz and 10 kHz. Second scanning level. For the norm, mastalgia as a symptom of the premenstrual syndrome, and for the pain syndrome, at mastopathy of the different types, there are characteristic the own indices of electroconductivity, allowing to differentiate different pathology of mammary glands at using the EIM method. At presence of the pain syndrome of any etiology, in mammary glands decrease of electroconductivity, in the comparison with the norm, is observed in all menstruating women. At examination at the 50 kHz frequency. At the 50 kHz frequency, electroconductivity at mastalgia takes intermediate position between the norm and mastopathy in all age groups at menstruating women, till 50 years, in both phases of MC. But it is impossible to carry out the differential diagnostics between the pain syndrome and at the syndrome of premenstrual tension at mastopathy at using of a single frequency measurement, because in both cases decrease of electroconductivity indices in the comparison with the norm is observed. Clear diagnostical criteria are manifested at additional scanning at the frequency 10 kHz. At the frequency 10 kHz, the indices of average electroconductivity of mammary glands at mastalgia during the first phase of the MC are higher than in the norm, and at any type of mastopatia in the corresponding age groups, and during the second phase, they take up intermediate position between the norm and mastopathy. Mammary glands electroconductivity in norm and at pathology at women of different age groups, in different phases of menstrual cycle, and during post-menopause. 10 kHz. Second scanning level. Mammary glands electroconductivity in norm and at pathology at women of different age groups. 50 kHz and 10 kHz. Second scanning level. At mastalgia, as opposed to norm and different types of mastopathy, the clear statistically reliable decrease of electroconductivity during the second phase of menstrual cycle at corresponding age groups with frequency 10 kHz is seen. There's no difference in the phases of the menstrual cycle at the mastopathy of different types when there is electroconductivity. Mean indices decrease comparing with norm at frequency 10 kHz. Mammary glands electroconductivity at different types of mastopathy at women of different age groups in different phases of menstrual cycle and during postmenopause. 50 kHz and 10 kHz. Second scanning level. Mammary glands electroconductivity at different types of mastopathy at women of different age groups in different phases of menstrual cycle and during postmenopause. 50 kHz and 10 kHz. Second scanning level. The clear diagnostical criterion for mastopathy of the first type is absence of significant difference between indices of electroconductivity at the frequency 50 kHz and 10 kHz in the corresponding age groups in both phases of MC. The clear diagnostical criterion for mastopathy of the second type is also decrease of average electroconductivity at the frequency 10 kHz in comparison with the frequency 50 kHz in both phases of the MC in the corresponding age groups. The diagnostic algorithm of mastalgia of various etiologies, using the method of multifrequency electrical impedance mammography. 50 kHz, 10 kHz, norm. 50 kHz of norm. 50 kHz of norm adipose involution. Mastopathy. Mastopathy 1 type, non-cystic, 50 kHz equals 10 kHz. Mastopathy 2 type, cystic, 50 kHz, 10 kHz. Mastalgia as symptom of premenstrual tension. 10 kHz, 50 kHz, 10 kHz, of norm with 10 kHz, in first phase of MC. Electrical impedance, images at mastopathy. Electroconductivity at 50 kHz is 0,47 AU, what is below the age norm and is typical for mastopathy. Electroconductivity at 10 kHz is 0,34 AU, what is also below the age norm and 50 kHz below than the result at 50 kHz. According to the diagnostic algorithm, it corresponds to the second type of mastopathy, with cystic component. Images showing EIM. 50 years. Second scanning level. Electrical impedance, images at mastopathy. Electroconductivity at 50 kHz is 0,26 AU, what is below the age norm and is typical for mastopathy. Electroconductivity at 10 kHz is 0,26 AU, what is also below the age norm, but does 50 kHz not differ from the result at 50 kHz? According to the diagnostic algorithm, it corresponds to the first type of mastopathy, non-cystic variant. Image showing EIM. 21 years. Second scanning level. Electrical impedance, images at mastalgia. Electroconductivity at 50 kHz is 0,44 AU, what is below the age norm. Electroconductivity at 10 kHz is 0,46 AU, what is over the age norm, and over the result at 50 kHz in the first phase of MC. According to the diagnostic algorithm, it corresponds to the mastalgia as the symptom of the premenstrual tension. Image showing EIM. 44 years. Second scanning level. Electrical impedance, images at adipose, involution. Electroconductivity at 50 kHz is 0,71 AU, what is over the age norm and is typical for adipose involution. Electroconductivity at 10 kHz is 0,51 AU, what is typical for the norm,